Good afternoon, everyone. This is Julia Schneider, Director of Chronic Disease Prevention at the Association of State and Territorial Health Officials. I would like to welcome you to today's interactive webinar, Salt in Your State, Sodium Reduction Through Procurement Strategies. For several years, ASTHO has been working with state health agencies to improve the nutritional content of the food and decrease the consumption of sodium. From 2010 to 2013, ASTHO, with support from CDC's Division for Heart Disease and Stroke Prevention, convened a working group of 7 states aimed at building their capacity for sodium reduction efforts and specifically focused on using government food procurement to improve the nutritional quality of food for state employees and state programs clients. 2 of the participating states, Massachusetts and Arkansas, will present about their sodium reduction efforts during this webinar. In addition, Washington State will speak about their recently passed executive order to ensure access to healthy foods in state facilities. We have an esteemed panel of experts that will be speaking with you today. Following my introductions, all of the speakers will present about the various strategies in their states to address healthy eating. If you have a question for one of our speakers, please post it to the chat box on your screen at any time during the webinar. These questions will be used during the Q&A after today's presentation. At the conclusion of the webinar, you will be directed to an evaluation survey. Please take a few minutes to inform us about the work you are doing to encourage healthy eating and reduce sodium consumption, and provide us with feedback on today's webinar. We look forward to hearing your comments and will follow up with you afterwards. Also, a recording of this webinar will be posted to our website in the next few days. The site is available on the last slide. Next, I would like to introduce Jessica Levings from CDC. Jessica serves as a federal contractor and policy analyst at the Division for Heart Disease and Stroke Prevention and supports the agency's sodium reduction initiative. Jessica?
Thank you, Julia. And thank you, everyone, for joining the webinar. We do hope the information that's provided today will help you with your sodium reduction efforts. We also just wanted to let you know about a new exciting resource that you could also find helpful. A supplemental issue of the Journal of Public Health Management and Practice has just published a supplement related to CDC's Sodium Reduction in Communities program work, and it really covers the methods and the progress and the lessons learned from the first round of communities. It was published online ahead of print in an open access publication on the journal's website. And for those of you who aren't familiar, the Sodium Reduction Communities program was launched by the CDC in 2010, and it works on the local level to increase the availability and access to lower sodium foods in settings like schools, work sites, grocery stores, restaurants, and congregate meal programs for older adults. So if you're interested in reading the articles in the supplement, you can visit the Journal of Public Health Management and Practice, and you'll find it there online. And thank you again for joining the webinar today.
Great. Thanks, Jessica. Our first speaker is Katie Bishop. Katie is a Nutrition Policy Associate at Center for Science in the Public Interest, CSPI, a leading health advocacy organization that specializes in food, nutrition, and obesity prevention. Katie?
Hello, everyone. So at CSPI, I specifically work on providing support and technical assistance to states and localities that are working on healthy food procurement policies. And I just wanted to share some of the resources that we've recently come out with that might help all of you in your work. And also just to mention, I help people with policies related to vending, cafeterias, concessions, institutional feeding, and meetings and events. So one of the new resources is a fact sheet on how to choose nutrition standards for your state or locality. So this is just a fact sheet that sort of walks through step-by-step different things that you would want to consider while you're putting together your nutrition standards. You know, what types of venues you would want to cover, what nutrients should be covered in a comprehensive policy, just things to look out for when you're putting your policy together. And then another one of the new resources is a fact sheet that sort of lays out the different national nutrition standards for vending machines. So you can see how the different standards compare with each other. You can just read straight across what do they have for calorie limitations, what do they set for saturated fat limits, just so you can easily compare them. And then we also highlight different areas that we think might be problem areas. So if you wanted to use a particular standard, you might want to address those areas and modify the standards a little bit. And another fact sheet that we've come out with are tips for successfully implementing healthy food service guidelines. So these are different tips that we've heard from states and localities that have been implementing procurement policies that have really worked for them. So instead of just putting a policy in place, they're putting a policy in place and then using some of these other tactics to really make sure that people are eating the healthy foods, and the healthy foods just aren't sitting in the vending machines or sitting in the cafeterias, but people are actually buying them and consuming them. And then another thing that we've recently put up on the website are 12 different promotional posters. So these are posters that we want you to be able to take off our website and use in whatever way works for you. So you could put your department's logo on there or put your state's logo on there, so you could really brand them to be your own. And we have ones for foods, for beverages, some directed at children, so you should really go and check all of those out. And then also just a quick refresher of some of the other materials that we already have up on the website. We have model policies, we have a financial impact fact sheet, so examples from states and localities that have implemented healthy food service guidelines but haven't seen a drop in revenue. We also have a list of all of the states and localities that we know have passed healthy food procurement guidelines, and then other general fact sheets and toolkits. And they're not all CSPI policies, but some of them are just great resources that we found from CDC or from the Heart Association that we think will help people in this work. And then one other resource that we'll have coming out soon is a healthy meeting toolkit. So that has guidelines for healthy meetings. It's a two-tiered system, so there's the standard healthy meeting, but then there are also superior healthy meeting guidelines if people want to go that extra step, or else you could sort of mix and match for whatever works for your department or organization. And that comes with a whole comprehensive toolkit, so it has things like how to talk to a caterer about reducing sodium, how to negotiate with a hotel about having a healthy meeting there. So there are all sorts of really great resources that can help people to have a healthy meeting. And finally, there's just my contact information if people want to reach out if they have any questions about these materials or other things that CSPI does.
Great. Thank you so much, Katie. I'm sure everyone has been able to find that really helpful. And again, if folks have questions for Katie, please put them in the chat and we'll address them at the end of the webinar. Next, we're going to move on to our first state presenters who are from Washington, and we'll be presenting about a new executive order that improves access to healthy foods in state facilities. Jessica Totorovich is a Deputy Secretary for the Washington State Department of Health. She oversees agency administrative operations including human resources, risk management, financial services, and information technology. She's been with the department since 2012 and has more than 15 years experience in state service. Jessica recently received the Governor's Leadership Award in 2010 for her work in labor relations. Colleen Arsenault is a healthy eating coordinator for the Washington State Department of Health Healthy Eating Active Living program. Colleen's roles include working with communities, schools, work sites, and state partners to help make their eating environments healthier through policy and environmental changes. Washington?
Thank you. Good morning, everyone, or good morning from the West Coast. This is Colleen Arsenault, and I will begin our presentation. I will start with giving an overview of the history of the executive order and how we arrived to this point. In 2009 and 2010, the American Heart Association and the Childhood Obesity Prevention Coalition observed cities beginning to consider citywide procurement efforts. They also saw a Massachusetts executive order signed. In 2010, graduate students from the University of Washington developed a policy analysis report. The purpose of this was to inform advocacy decisions of the Washington State Coalition for Childhood Obesity and other interested parties regarding the idea of creating standards for institutional purchasing food by state government. This report informed the content of House Bill 1801. In 2011, House Bill 1801 was introduced. It required each agency to develop and implement food purchasing policies for food purchased with state funds for meetings and events, food served in vending machines for state employees, and food served to people in direct custody of the state. In 2012, House Bill 1801 continued where it left off in the previous legislative session, but with a few changes. Some of those included food available to state employees from on-site vendors such as cafeterias and coffee shops was added. And then excluded from the bill would be the Department of Veterans Affairs, training programs conducted by the Washington State Patrol, and other criminal justice training programs. The bill changed from food procurement to food service. And in committee, House Bill 1321, as it moved forward, was recommended that the governor consider signing this as an executive order because of his interest in worker productivity. This executive order was signed on October 30th, 2013 by Governor Inslee. We feel the partnership between public and private organizations was key to arriving at the executive order. External advocates such as the American Heart Association and the Childhood Obesity Prevention Coalition helped jumpstart the issue and create legitimacy for it as an idea. Because of that work, this work then got prioritized within the State Department of Health, and the Department of Health was able to secure grant funding to support a position dedicated to food procurement. With dedicated staff, the Department of Health was able to form a food procurement work group made up of representatives from multiple state agencies, local public health departments, and other external partners. This work group had been meeting for over a year when the executive order was signed. Work group members developed the state's healthy nutrition guidelines and informed the development and content of an implementation guide. Their participation assisted their agencies and organizations in understanding and gaining support for this work. As you saw in the first slide, the framing of our message changed over time. In the first year of the bill, it focused on government efficiency in food procurement. Like many places, we do have a central contract for state agencies to purchase foods and other items. But we quickly learned that not all food served in state agencies is purchased through this contract, particularly not by the owner or operators of cafeterias located on state properties. Because of this, in the second bill, the frame was changed from food procurement to government as a model or early adapter. While this bill was in legislative committee, it was suggested by a committee member that the governor might be interested in signing this as an executive order because of his interest in employee productivity. The previous bills focused solely on food procurement or food service, but in the end, this executive order has a much more comprehensive worksite wellness frame with a focus on employee productivity.
Hi, this is Jessica. Welcome this morning. So this bill, as my colleague just mentioned, does have a very large framework, and we won't be covering all the pieces of it today, but it may be of interest to note that it covers things such as insurance benefits and possible incentives to reduce insurance benefits if you participate in certain wellness activities in the workplace, and some of that activity that is coupled with the food procurement that we're going to talk about today. So what I'm going to take you through today is just quickly go through the scope of the executive order and walk through some of the practical aspects of implementing this within state government. So as you can see, this executive order covers Washingtonians. It started out covering Washingtonians in general, and we really reduced that scope down in the executive order to really focus on state employees and the custodial populations that we serve. One of the things that was really important as we got started this was engaging our state agency partners. So just like Colleen spoke about our external partners, we also realized pretty early on we had to engage other state agencies, especially those that had large financial impacts, and that primarily focused around the custodial populations. There were also unique employee issues that we had to start thinking about, and we will continue to have to think about, because we have employees, as probably many of you do, in a wide range of activities with lots of different types of support when it comes to healthy eating. We have people who don't have set work sites. We have people who travel more than they're anywhere located, in one spot. So that becomes very difficult to think about. And then the custodial population, that's a huge group of people, and certainly they have rights and expectations that we need to build into this process. Our external partners helped with that, but also engaging the state agencies and really learning about the ways in which they interact with their custodial populations was really important pre-work, and we're continuing as we implement the executive order focus on that. So really trying to set the tone of being practical. The other piece that we're really interested in, and the governor is very interested in, is the measurable aspects of this to show a return on investment. So this will actually, the executive order is actually going to be tied into our overall state performance management program that we'll be reporting on. One of the things that we talked about was moderation. You'll notice that in our executive order, it talks about providing more options, not taking away options, particularly for the custodial population. That was really important, as well as for our union partners in dealing with labor issues. That was really important. We have made a focus on Washington-grown produce and resources, but we've also recognized that practicality and budget needs to be balanced there. One of the things that we talk about in our executive order is really leadership modeling the behavior, so not just providing the options, but what we're calling the nudge factor, which is also how do we as agencies and leadership model and set an expectation that folks will do this, but not necessarily have a specific directive in that regard. And then we talked about building in the ROI. One of the things that we did learn, some takeaway lessons that I'd like to share today that hopefully will help you in your work, is really engagement at all levels with state agencies. On our initial work group that Colleen talked about, there were a number of agencies that had staff involved, but as we moved towards the executive order, what we realized is the budget offices in those agencies and the agency leadership had not been engaged, so we did have to do some backtracking and bring them up to speed on some of the work as they thought about the budget implications pieces of that work. So I would really encourage sort of that full participation and really getting leadership involved initially as opposed to doing that after the fact. And then really the ability to acknowledge those unique situations, places where we have, shift workers, or so those would be employees that, don't have a common work site, that move around in facilities or even between facilities. How do you give them resources and tools? Very diverse work sites. We have some that have, cafeterias and those type of opportunities. We also have maintenance sheds out in the middle of nowhere. So how do we provide some options for all of those people? And then, as I mentioned before, the custodial population. Finally, I thought it would be good to cover kind of what our next steps are going to be. So at the beginning of the year, we are sharing our healthy nutrition guidelines broadly with the agencies, as well following up with a final implementation guide that will be used by agencies to help them step through the process, promotional activities, communications, marketing, those type of things, as well as making sure they understand the components that they need to provide in order to meet this executive order. And then really starting to talk about, okay, now that we've done this in state government, how do we explore that next level of engagement with our private sector partners, and really looking at where I think the governor would like to go, which is to Washingtonians as a whole. Promoting the leadership by example, the governor has a real interest in making sure his cabinet models these behaviors and these activities. And then we're applying for grant dollars so that we can do some assessment of this work and show some ROI. And with that, I will turn it over and answer questions at the end. Thank you.
Great. Thank you so much, Jessica and Colleen. We did get a few questions that we'll address at the end of at the end of the call. And as a reminder, please put your questions in the chat box. Next, our presenters from Massachusetts will present about their state's executive order for state agency procurement. We have Cynthia Barrell, who is the nutrition coordinator in the wellness unit in the Prevention and Wellness Division at the Massachusetts Department of Public Health. Cynthia has worked at DPH for over 20 years in a variety of capacities, including as the first Massachusetts State Special Needs Nutritionist and in primary care. Cynthia is the project manager for Executive Order 509, which is establishing nutrition standards for food purchased and served by state agencies. And Executive Order 509, which they will talk about, is one of the 6 Mass in Motion statewide wellness initiatives to promote healthy weight and improve the health of Massachusetts. Also presenting from Massachusetts is Margaret Berry, who is the dietitian and food service manager of the Morrison Healthcare Food Services. Margaret has extensive experience in acute and long-term care food service management. We're very excited to be hearing from both of them. Massachusetts?
Thank you. This is Cynthia, and I'll be presenting from the state agency policy perspective, and Margaret has kindly agreed to cover as an implementer of the executive order in a medium-sized facility. So our first slide here was actually covered by our introduction, but this is part of Mass in Motion, which is one of 5 components of our Obesity Prevention and Control Initiative. And if people want to know about the other ones, I'd be happy at a later time, but today we'll concentrate on Executive Order 509. So basically, the executive order, you can see, is based on not only the epidemic, the concept that a lot of state dollars, millions of state dollars, are used to feed in residential populations, and this initiative gives the opportunity to improve the range of healthy food choices to promote healthy lifestyles. Next. So the executive order was signed in 2009 by our governor. It impacts 8 state agencies. It's for new contracts, and it's for any agency that provides foods and beverages on a regular basis. So if you look at the bottom, the definition of the executive order is services to clients who are dependent on the state for a package of services, including food and beverages, and also the exemptions at that time, which I feel quite differently about at this time, but vending, concessions, and cafeterias were exempted because at that time, in 2009, it was felt that no state or federal tax dollars was used in these settings. It was really the employee or the client who was using their funds. The executive order itself, the language for the nutrition standards, is based on the dietary guidelines, and we actually have 68 state agency boards or commissions that do not meet the criteria, but we encourage them to use our Healthy Meeting and Event Guide, which you'll also find on our website. So basically, this is our target population. There's only 8, you might say, well, there's only 8 agencies, but it actually impacts approximately 1.4 meals and snacks a year. You can see the range of the agencies, anything from the Department of Children and Youth, which only has 1 shelter and has about 16,000 meals a day, on over to some of the largest, which is the mental health and the youth services, which have between them about 6,000 small community programs. Next. So basically what we did in our baseline is that we identified we sent our survey to all 78 boards, agencies, and commissions, and we found from their reply was that really the most challenging component that they were dealing with was sodium reduction, which I thought was very apropos to this discussion. But they also had 4 other areas that they focused on, which was how to prepare healthy food, how to increase fiber, how to improve snacks, and also healthy beverages. When we looked at some of the other key findings, the high cost of healthy food, mainly the availability and cost of lower sodium products was a huge challenge. And then basically the gaps that we found between the largest agencies that had food services and the 6,000 community homes. There was a huge variability in skill and training of the staff who buy and prepare the food, and then basically most of the staff in those settings do not know they may know how to cook, but not necessarily healthy. So basically what we did with Strategize is that we had 4 specific strategies that we worked on, which was getting internal partners, an interagency group, additional collaborations, and then obviously implementing, monitoring, and evaluating. Next. So I'll speak a little bit more about that at this point. Basically in the first phase, we, like one of our former speakers, we really up front got internal partners involved from legal, purchase of service, wellness, and policy. We looked at how this was going to be managed. We identified external and internal champions as the highest level being the governor, the mayor or commissioner. In our case, it was the governor, but there may be other people that you identify. And the focus was which kind of a vehicle would be used. Would it be policy, an executive order, the definition of the language, identifying what some of your baseline is, what your gaps and barriers are, looking at who's the impacted agency, and looking at the advisory group. I'll speak about that a little bit more, and developing an implementation plan, and once again, the evaluation and monitoring. And the next stage, which is really pretty key, each of the 8 agencies appointed their official representative of the highest level that dealt with food service management, and they helped us with a variety of tasks, including the baseline survey. They reviewed and approved the standards, and we pretty much used what New York City had. And basically the main issues, which was really based on food preparation skills and training, and then site visits to try to identify what some of the training and implementation needs would be. They provided input into the online course, which we have with our academic partner, Framingham State University, and they provided input on the web-based resources and tools which are accessible to you all on our web. The next thing we found was pretty key was working with state agencies, and this has been alluded to by a prior speaker, but we basically worked with our department's own purchase of service, and we also worked with our sister agency, which is the Mass Division of Operational Services, to embed the executive order nutrition standards into all new contracts. We collaborated with Operational Services Division on long-term RFPs for food, and we actually have, I forgot to put one on, but we have a catering, a bakery, a prime grocer, and a dairy contract. So those are specific food, although the nutrition language is in all new contracts. And then we've done a number of presentations and provided technical assistance to a variety of groups to pull in more partners to strengthen the collaboration. Next. So basically what our challenges were is that the smaller community-based programs, which I mentioned is about 6,000, each of these 3 components, I think, impact sodium and sodium level, that the staff is less trained in healthy food preparation. There's little or no access to the large food vendors, and I think a former presenter, even though we have the food contracts, the smaller vendors do not necessarily use them for a lot of specific reasons. And obviously these smaller community homes that house from 3 to 10 clients have much smaller budgets, and so their capability to buy in large quantity wherever is a problem. Our monitoring is self-reported, and the state contract system at this point in time is more concentrated on money spent, not necessarily on outcomes like how was there an increase of fruit and vegetable or an increase of whole grain, for example. Next. So lessons learned, we found that the procurement policy is a fantastic opportunity to be an umbrella over many goals so that you don't have to do each of these initiatives alone or in a silo. And obviously the ones that we're most interested in, and we've been working on it for a long time, are listed here, including sodium reduction. We really needed a robust implementation plan between agencies. We really needed to have a very strong food preparation and procurement training program and a monitoring system. We needed to have some work with leveraging purchasing power, and Margaret's going to speak about that in a minute. And we basically, I think, need to have learned, include this in a worksite wellness capacity with vending, catering, and concession stands and cafeterias, because in many of our state agencies, we learned that even though this language was exempted, that they are very interested in making progress in these areas. Next. So some of our initial success stories in a nutshell is that we were actually able to implement healthy eating language in the public health hospital contract, which was right before the executive order was signed. That's a 10-year contract worth $100 million, and that included not only options for patients but employees, so that we did have a component of worksite wellness. Mental health uses our standards as the house diet for the hospital, which I think is pretty phenomenal. The veterans has recently reported that they have reduced their sodium consumption by about a half by doing things like making soups instead of canned, having salad bars, and the really nice thing is that these foods are also available to the employees and visitors in the cafeteria, so this is a kind of a spin-off wellness program. Operational Services Division has involved me in working with the other agencies in developing language and adding foods, healthier versions, and the gross RFP alone is worth $14 million a year, so we're talking high stakes money here. Developmental Disabilities Agency, over 2,600 of their staff who procure and prepare food have taken our online course, and basically through the work of the developmental disabilities, we have worked on medium and small programs, and we have some thoughts on some current and future pending, and this is where my wonderful colleague Margaret will step in and present what she's been doing in both a medium and a small agency. Margaret?
Thank you, Cynthia. As the food service manager for Morrison Healthcare Food Services, which is a sector of Compass Group, the largest food service management company in the world, I've had an opportunity to work closely with Cynthia in a medium-sized facility managing this implementation. It's been a challenge. I won't say that it hasn't been. But the resources that Morrison brings to the table have been a huge help. One of Compass Group's sectors, a purchasing sector, a procurement sector, if you will, food buy, has been very helpful in terms of negotiating contracts with food manufacturers, working with the people that produce the canned foods and so on in order to provide us at the operations level with products that are lower in sodium. For instance, we now have a lower sodium marinara sauce, which is, as you can well imagine, widely used on our menu. Our staff have been trained on food safety and health promotion and special diets, and especially the EO 509 nutrition standards. In addition, in the facility, we've used the EO 509 fact sheets just to refresh people's memories. In addition, I've had the opportunity to work with a single registered dietitian who is currently providing technical assistance to residential facilities. Initially, that opportunity came when some of our larger inpatient facilities closed, and those residents were relocated into community residences, and there was a terrible need for consultation from a dietitian. And so that gentleman got involved in consulting on tube feedings and various other things, discovered the lack of knowledge in those units, and began providing training on food safety and menu development and EO 509 nutrition standards and reducing sodium in the diet. One of the advantages of partnering with a food service company is that it eliminates the need to reinvent the wheel because, as you know, we're located across the nation, and the procurement systems that we have in place and the culinary experts that work with us, the chefs developing recipes and menus, and the dietitians, all bring resources to the table. Cynthia, I'm going to turn it back to you.
Sorry, I didn't realize I was still muted. My children would have loved that. In our next steps is that we're going to be updating our standards to include the Massachusetts and the USDA competitive foods and the hot meal standards, because in some of our agencies, include the Department of Youth Services and in our shelter, they would be following 2 sets of standards, so we want to make it seamless. We're going to continue our online course and web resources because we found that that was so vital to our community programs particularly. And then pending funding, we want to conduct a baseline survey in the small community programs. We recently conducted a second survey last winter in the large agencies, but now we want to conduct one into the small community settings to gauge the influence of our mass in motion community food policies, such as healthy restaurant and the healthy markets, on the foods that are available to these clients. In our findings from the large agencies, we found about 50% of the clients eat some type of food outside their residential home, anything from a cup of coffee or when their family takes them out to dinner on a weekend. And so we realize that it's really important not only to have healthy food within the program where they live, but to have it in the neighboring community if we want to continue. So that's our plan for the next step, and I would just really like to acknowledge the numbers of people who have been involved in this, and you can see the various capacities, which we have been told has made this move positive because this was an unfunded mandate. And so that's the end of our presentation. We look forward to questions at the end. Thank you.
Great. Thank you so much, Cynthia and Margaret. And we do have a few questions for you that we'll get to at the end of the presentation. Our final presenters are from Arkansas, and we'll be discussing the state's worksite wellness program for state employees. Presenting will be Katrina Betancourt, who is the Worksite Wellness Section Chief for the Chronic Disease Prevention and Control Branch of the Arkansas Department of Health. Katrina is the administrator of the Arkansas Healthy Employee Lifestyle Program, a comprehensive worksite wellness program for state employees, and she has created the Community Healthy Lifestyle Program for worksites throughout the state. Katrina is also joined by Linda Faulkner, the Healthcare Systems Lead at the Heart Disease and Stroke Prevention Division of the Arkansas Department of Health. And I turn it over to Arkansas.
Thank you. This is Katrina, and what we're going to talk about is basically how sodium impacts Arkansas and our work sites. So I'm just going to give you a brief overview of what we're going to discuss. As she mentioned a second ago, there's 2 worksite wellness interventions here in Arkansas, both A-HELP and C-HELP. And then we're going to talk about how sodium is impacting our state currently and the evaluation of nutrition within current A-HELP with our current A-HELP participants, and then the nutritional strategies that we're using in our work sites. So this right here is A-HELP stands for the Arkansas Healthy Employee Lifestyle Program, which is based on state employees at their work sites in our agencies, boards, and commissions. And then our Community Healthy Employee Lifestyle Program, which uses the same model, but it's for non-governmental work sites such as private practice or local government or nonprofit. We did have a video to show, but we're not able to show it, so if you do want to see the video, I'll be more than happy to show it to you at a later time or send you a link for that video. But basically, A-HELP is to create a worksite culture that supports healthy lifestyle choices for our employees, like I said, at state agencies, and we use that same model for our C-HELP program. It is at the director's discretion, so we do involve leadership. We have a web-based tracking system, which is a self-reported data that they can log in their cardiovascular activity, their fruit and vegetable intake, their other exercises like flexibility and strengthening, and whether they're tobacco-free or not. Then we have some yearly activities they can log, like if they participated in a marathon, if they completed the health risk assessment, if they got an annual physician screening. So there's a lot of different ways to earn points, which brings me to our incentive-based program that's tied in with this. In 2004, the program first was piloted, and then by 2005, we actually passed a law for participation in AHELP that employees could receive up to 3 days off as an incentive for participating and completing the challenges. From that, in 2012, we actually created our C-HELP program, which is modeled off of our A-HELP program. And when companies bring this program on, part of it is that incentive base that they allow up to the 3 days off as an incentive for participating and meeting those challenges in physical activity, nutrition, and tobacco cessation. So we're going to talk a little bit about sodium in Arkansas. Okay, if you look at this, based on a 2007 study that was conducted, the average daily sodium intake among adults in Arkansas was 900 milligrams per day over the recommended intake for the general population at 1,700 milligrams per day. So, and these were over at-risk populations, which at-risk includes African American adults age 51 and older, or any persons of any age with hypertension, diabetes, or chronic disease. So I'm just showing you the impact of where Arkansas stands. Now, this was an evaluation that was conducted in 2013, which was recently. It was just done in August. And there was a total of 2,174 Arkansas Department of Health employees reported health behavior and outcomes through the health risk assessment that we have. And it was between the years 2010 and 2013. What we found is there was more female employees actually participate in this program, and which in turn there was more that responded to this evaluation and the health risk assessment than the male counterparts. The racial and ethnicity distribution of AHELP contributors was submitted for the health risk assessment, and they were predominantly white, and the majority of the respondents were between the age of 30 and 50 years. So here's some of our findings. Here's a distribution of disease conditions among employees. So in this figure, there was high blood pressure, high cholesterol, depression, and arthritis were the most prevalent. The slide, this particular slide is healthy food consumptions of fruit, vegetables, grains, dairy, and high-quality protein. Participants reported in the range of 5 to 7 times per week for most employees, which is very, very low considering the standards for fruit and vegetable intake. This really should be, say, daily, but this was done for weekly. And these, again, just a reminder, these are all state employees. Figure 3 shows that the consumption of processed meat, fried foods, fats, sweets, and desserts averaged 1 to 4 times per week for a majority of the employees. I'm just leaving it up there for a second so you guys have a second to look at it. All right, so the following are current strategies that we're using in AHELP and C-HELP to kind of combat this unhealthy lifestyle choices. We currently have a policy that approximately 80% of our AHELP agencies and about 60% of our C-HELP work sites have implemented. It's a healthy choices at official events policy. This policy states at a function, which means a meeting, reception, conference, meals, breaks, trainings, or other similar events, at least 50% of the food and beverage items served are healthy choices. This includes events sponsored by the agency or state funded. Even if the food and beverages are not paid for by agency funds, sodium reduction is identified in food standards within the policy. So the next one is promoting the adoption of food service guidelines and nutritional standards, including the reduction or elimination of sodium-rich food and beverages. We're following and have adapted the Health and Human Services and General Service Administration Health and Sustainability Guidelines for federal concession and vending operations at all of our work sites. And we have approximately over 300 work sites, and just in our state government we have about 37,000, or sorry, that's a bit high, 37,000 employees within the AHELP program. We started our CHELP program in 2012, so currently we have about 30 work sites, but close to 3,000 employees at those work sites. The Department of Health also provides technical assistance to DHS for the blind to increase vendor participation with nutritional standards and guidelines to support the Randolph-Shepard Act. So the Arkansas Department of Health and the Arkansas Department of Human Services work together to help educate blind vendors, and they actually manage the blind vendors at their department. And of course, we always assess and evaluate and target our AHELP and CHELP employees to just see how we can improve the nutritional standards at each work site. Okay, we did draft an executive order, and it's currently under review, but states that it shall produce, disseminate, and implement guidelines for nutritional food and beverages in compliance with our federal guidelines for concession and vending operations. The guidelines should be in effect for state employees and their guests at breaks, meetings, conferences, and other work-related events held on public property. So this is coming from the procurement side and not just the policy side for employees and what they purchase. In addition, it states the Arkansas Department of Human Services shall disseminate guidelines establish minimum nutritional standards for food and beverages sold at vending facilities on public property. So for the purposes of this order, the term public property is limited only to those properties in the executive branch or state government subject to administration by our Arkansas Department of Finance and Administration. And this order applies to all vending and food services that are at our public properties. And here is my contact information, like I said earlier, if you guys want any of the links to our resources or to our website, and we do have that video there as well that explains about AHELP and CHELP a little bit more in depth.
Great. Thank you so much, and thank you to all of our speakers. We've definitely had a number of questions come in, so I'm going to now switch over to the Q&A portion of the webinar so that we can get to as many questions as possible. And then our last slide does have contact information for staff at ASTHO. So if your question didn't get answered and you'd like to connect with one of the speakers through us, we're happy to facilitate that, or many of the speakers have put their contact information up. We've gotten a lot of questions just in terms of staff capacity and the time that staff take to implement many of these programs, and also funding for these positions. So if all of you could briefly address those questions, I'd really appreciate it.
Hi, this is Colleen from Washington, and the funding for my position comes through our statewide community transformation grant, and we have since also received the Sodium Reduction in Communities program, so part of my time is now on that, and so most of it is CDC funded through that.
Great. Does any Arkansas, do you want to answer that?
I'm sorry. I guess I missed the question. Is it concerning funding?
Just, yes, concerning funding for the program and also funding for your staff time and how much that takes.
It's all of our, well, I'm going to say all, but majority of our work, yes, is done through worksite. So I am the worksite wellness section chief. So I'm going to say there's a high percentage for the nutritional guidelines and standards. Our funding does come, none of it is state revenue. All of it does come from CDC currently.
Great. In Massachusetts, I'm going to direct the question to you as well, and specifically somebody asked about Cynthia's time and how it's different when the executive order first passed versus now.
Well, when the executive order first passed, I was on 805 funds, CDC funds, and now my funding is from the 1305. But due to many emerging and important issues, my capability to work on this as intensely as I have been will be modified.
Okay, great. Thank you. And speaking of the 1305 funding, there was also a question that came in asking how the states are fitting their work into this CDC grant. Does anybody want to answer that?
Well, with Arkansas, it was kind of a natural progression because we had already started this work with our healthy options policy, but one of the requirements is to implement, nutritional standards and guidelines. So we just naturally were able to use the federal guidelines and start our work with disseminating and educating on the nutritional standards and guidelines. And we're hoping to get more involved with the executive order or hopefully passing some heavier policy to really work with our vendors.
Great, thank you. Does anyone else want to address that question?
This is Colleen, and here in Washington, our work started, and as I just said, is funded first through the Community Transformation Grant and then through the Sodium Reduction in Communities program. And so when we wrote our 1305 grant, we really focused on really looking at early childhood, working on nutrition guidelines at that level because our executive order really focuses on employees. But now we're kind of taking a step back and re-looking at it and seeing how we can incorporate it with the executive order, and the scope is much larger than we had originally anticipated. We're kind of re-looking at it and thinking how to include pieces of it in 1305. But I think there's a lot of people who have multiple funding sources from CDC. We're trying to make sure that that our pieces don't overlap. So.
Great, thank you. And there was a question about what recommendations do you have for creating monitoring systems on a food procurement policy for city contracts? Do any of the speakers want to address that?
I can say Arkansas is currently not working with city contracts right now, so we don't have anything to address with that.
Okay,
Neither is
we
Washington.
can follow up with. Okay. And many of you have mentioned other resources that you use as you develop your nutrition guidelines. So there was a question about, do the guidelines that you all develop look similar to any of the major national organization guidelines? So if you just want to kind of go through some of the federal, national, maybe other state and city examples that you use, I think that would be helpful to the participants.
Well, Arkansas is really just adapting the federal guidelines to be specifically to our state, and the ones that we're using are the Health and Human Services and General Service Administration Health and Sustainability Guidelines for Federal Concession and Vending Operation. I apologize for that long-winded, but basically it's all one document. So, and I guess the easiest way, I don't know if we can post it, or you can literally Google the Federal Concession and Vending Operations, and you'll be able to find that document. It's been very valuable to Arkansas with dealing with procurement.
This is Washington, and we use the same guidelines as well, but we've also looked at the USDA Smart Snacks in Schools guidelines for our vending. Seattle-King County Public Health here in Washington, they had developed vending guidelines which ours closely mirror. But when we went to write our cafeteria and our institutional food service guidelines, rather than most of the guidelines that are out there are very nutrient-based, and most of our smaller institutions and most of our cafeterias and smaller cafes and delis are run by small businesses, and they don't have the ability or capabilities to do nutritional analysis on their foods. We will have some small resources to help them with this, but we don't have a lot. So those guidelines of ours were written, they're food-based rather than nutrient-based. So our work group worked long and hard on developing those so that they make sense, but also really support the dietary guidelines for Americans, which are the basis of all of our guidelines.
In Massachusetts, we used, with our nutrition standards, we used the dietary guidelines, but we utilized the tool that New York City had presented. And since vending was exempted, vending is in our 1305, so we're in the process of comparing existing tools because we feel that there's no need to develop a Massachusetts-specific tool. So we're looking at, obviously, the federal tool, but we're also looking at the NANA tool because there is a pending state legislation that would have vending in all state buildings, and if that passes, it would be the NANA guidelines. So we're going through an objective process to look at what currently exists that we could use, that we could propose that be used in vending.
Great, thank you. So a question for Arkansas. How effective is policy change at the work site on employees? Do nutritional behaviors change?
And what we found, like I said, our program has been in existence since 2004, and that evaluation that we did was between 2010 and 2013. There has been, if you compare other years, there has been a positive effect. As we see overall, the statewide, we're getting more obese and other chronic conditions are on the rise. So we have seen a positive effect. Again, it's over time, but we're still not where we need to be. And I think that's why this natural progression of how can we change procurement. We can't always change behavior of a single individual, but if we at least provide those healthy options, then they can make their own healthy choices. So we're just providing supports.
Great. And I'm going to ask one final question that I think is really relevant, especially to the ASTHO audience. But do you have any tips to get buy-in from leadership? And I'm going to allow that to be kind of a closing comment from all of the states. If you could all address that, and then I'll have some final comments, and we'll finish up.
Well, I'm sorry to speak first, but this is Katrina with Arkansas, and I would say that we have something in place as it is with our 2 interventions that we actually address it at the leadership level to begin with. So in order for these programs to be implemented at those work sites, we have to have a letter of intention, basically, to be a part of this program. So we've already done the groundwork. We work with leadership and get them on board first before we even implement this into the program, and we found that to be very effective.
This is Colleen in Washington, and we, I think, through a bit of the work, through our CTG leadership team, there are a number of leaders from different state agencies that are there. So they've heard about this work, been talking about it a lot. I think the work, again, from our private partners, as I mentioned, was really integral in kind of getting this topic on people's radar. And then finally, I think our leadership here at the agency really working with their peers in the other agencies. So Jessica worked really closely with the deputy directors and talked with them a lot about this work and really got their buy-in and listened to the concerns, and we really took their concerns into account when we wrote, not only when the executive order was written, but also when the guidelines were written. And as well, our secretary, he did the same with his peers in the cabinet.
Massachusetts?
I think that we had quite a bit at different levels. I think that our commissioner our former commissioner was a wonderful champion. He was the president of ASTHO, and I think a lot of this initiated from his leadership there. As president of ASTHO and being our medical director, being involved in the sodium regional work group, obviously his influence on the governor. And I've been told by our procurement deputy here, that she really believes that it was the dedication of the leadership in the state agencies that would really started with the commissioners, but the person that they appointed and the work that they've done, because it's amazing how much progress has been made considering the limited amount of this. It's an unfunded mandate, and there is a limited amount of technical assistance. And so and they're the ones that are directly working with the people in food service. So I think it's really important to have a champion and leaders on all levels to demonstrate the dedication behind this, from the highest level to the people working directly in the trenches of buying and procuring healthy food.
Great. Well, thank you so much to all of our speakers today. I also wanted to let everyone know that ASTHO has our own internal healthy foods policy and works very closely with our vendors to provide healthy foods at all of ASTHO meetings. And our healthy foods policy is available on our Worksite Wellness website for other organizations, state health agencies, and partners to use as a resource. And you can see our resources here on this last slide, both our sodium reduction website and also our Worksite Wellness website. As I mentioned earlier, you will also be directed to an evaluation at the conclusion of today's webinar, and we'd really appreciate it if you took a few minutes to complete the survey, as it provides us with useful information for upcoming projects. And it also has questions related to the work that you are doing in your state. And as you may know, we have had a technical assistance project in the past, and we're launching a new working group for states interested in pursuing sodium reduction projects and food procurement work. So you can use the evaluation to express your interest in participating, and we will follow up with you afterwards. Again, I would like to thank the CDC Division for Heart Disease and Stroke Prevention for sponsoring this webinar, and I'd like to thank our speakers, Katie Bishop, Jessica Tatorovich, Colleen Arsenault, Cynthia Barrell, Margaret Berry, and Katrina Betancourt. A recording of our webinar will be available on our website within the next few days at the web address on your screen on our sodium reduction website. And we hope that this webinar will serve as a resource for you, and please feel free to disseminate the archive. If you have any follow-up questions about today's webinar or need help connecting to any of the speakers, please contact our team that is noted on the slide. And otherwise, we will wrap up, and we thank you so much for your participation and hope that you enjoy the rest of your day. Thank you.